You're watching Local News Network Durango. I'm Wendy Graham-Settle. A working group that includes Local First, local healthcare providers, and business owners hopes to establish a local purchasing collaborative to lower health insurance costs for Southwest Colorado residents and businesses. Local First, along with the Durango network of healthcare providers, San Juan Basin Public Health, and the Rocky Mountain Health Foundation recently released the results of a 6-month community health assessment that analyzed healthcare needs of local businesses. Not surprisingly, the cost of insurance premiums and the cost of healthcare was the top concern among employers who want to provide health insurance to recruit and retain good employees.
The rising cost of healthcare has made it really hard for businesses, especially local and independent businesses, to compete in the marketplace, to retain employees, and it's become more and more of an expectation that employers need to provide health insurance to their employees. And so the business community was saying that's really tough for them. They would like to see what Local First and what the community could do to maybe share some of those costs, to have maybe some shared pooling or cooperatives around healthcare and really try to lower the costs.
The study found that the average cost for health insurance premiums in Colorado have increased by 58% since 2008. Individual premiums have risen an average of 50%, while family coverage jumped by 58%. And it's more expensive to purchase health insurance if you live on the Western Slope. According to analysis by the state's Division of Insurance and the Colorado Commission on Affordable Health Care, West Slope outpatient services are 87% more expensive than the Front Range, and small rural counties with little competition in the medical industry have the highest insurance premiums. As a result of the needs assessment, Local First has formed a work group to determine whether a healthcare collaborative would work in La Plata County. The group is looking to Peak Health Alliance in Summit County as a model.
By banding together in Summit County, they were able to increase their negotiating power and really directly negotiate with some independent providers as well as the healthcare providers in their community, such as the hospital, to reduce their insurance premiums by 20%. Then the next thing that they do once they've negotiated with the providers is ask for health insurance carriers to put together a plan. So something like a Rocky Mountain Health plan, right? So that you can go onto the marketplace and now purchase this. You live in Summit County, whether you're an employer, an individual, you can now go on the marketplace and receive the benefits of this negotiated local solution to healthcare.
Local First Working Group has hired Segway Consulting, which helped Summit County form its collaborative. First steps will be to gather and analyze health insurance claims from the region. DeGiorgio said the effort to develop a collaborative will cost about $100,000, and Local First has started fundraising and seeking grants to cover expenses.
In the long term, we're going to see, we hope, a local solution to healthcare that will reduce all of our costs by anywhere between 10 and 20%. That would be our goal, and that's where we hope to be in 2021.
If you'd like to know more or to support the collaborative healthcare effort, visit local-first.org. Thanks for watching this edition of Local News Network Durango. If you liked this story and want to watch it again, visit our website at durangotv.com, where you'll also find an archive of our past stories. You may also catch us on Durango Cable Channel 15 or on one of the many digital signs located around town. I'm Wendy Graham-Settle for Local News Network Durango.